How do you know if you have a gluten intolerance? Now, some people, they eat gluten and they feel it in their gut and they feel bloated and they get constipated and they get reflux and they know. But what if that doesn't happen to you? So sometimes it can come out in your skin. So you can get eczema or psoriasis. You might get those funny bumps on the back of your arms. You might get these little blisters on the sides of your fingers that are super, super itchy, or your toes. And that's actually a really strong correlation to celiac. So that's stuff in your skin. There's people that get affected in their brain. They eat gluten and they feel dizzy. They feel like they get a migraine, or they get this constant pressure in the back of their head. So that's something that you feel like something's wrong every time I eat that. I feel like that. Or you feel like that your memory isn't as good as it used to be. These are things that we can consider. Now, with little kids, I often see that these kids will have like explosive behavior. They'll be aggravated and irritated. They'll punch somebody. They'll have behavior that's just uncharacteristic after they've been exposed to gluten, and sometimes gluten and dairy, like birthday parties where they have cake and pizza. So that can happen. They can feel like their legs are painful at night, like they have growing pains. They can feel irritated and agitated and not sleep really well. They can feel like they're having drug-seeking behaviors or alcohol-seeking behaviors when they turn into teenagers, because this can cause some anxiety and depression in their brain. So these are all really important things to consider when you have these types of symptoms happening. Dig into gluten, take it out for a couple weeks, see how it makes you feel. Put it back in for a day, see how it makes you feel. That's a gold standard way of checking this out. And then you don't have to put any money forward on any expensive testing, but it's sometimes a correlation. One more thing is that if you have a relative that has non-Hodgkin's lymphoma, that has a very strong correlation with celiac. So if you have that in your family, check it out. Maybe there's more celiac in your family than you realize.